Hello ladies and gentlemen, my name is Ashley Alger. Today is June the 17th, 2017, and this is Devin Kearns. She's my little cousin. She's going to be the one doing the blood pressure. I'll be taking her blood pressure. She's going to be my person to do today. You know when you go to the doctor's office and they take you back to the medical room to get your blood pressure before the doctor sees you? Well, that's what I'm going to teach you today. Hypertension is an extremely common cardiovascular condition that can contribute to several health problems. It is very important to know how to take a blood pressure and when to get it checked. If you're having chest pain, that is the very first common symptom, whether it be a stroke, heart attack, heart failure, something. It's the first thing you want to seek medical attention for. Whether it be at your local rescue squad building, the doctor's office, or your local hospital, just walk in and ask them to take your blood pressure and they will be more than welcome to. You want to keep track of your blood pressure. You would like to keep it on a notepad, at least get it checked once a month, once a week, something. You want to keep track of it. Okay, the material you would need is a blood pressure cuff. This is adult size, and you want a stethoscope. Okay, first you want your patient to be seated, relaxed, with their feet flat on the floor. If they have a long sleeve shirt on, you want to make sure that you can roll it up, because you can get an accurate reading with your blood pressure cuff over top your clothes. You want to make sure you have the correct blood pressure cuff. This is adult small size. It will fit perfect for her size. The nurse will place the blood pressure cuff on your arm, the appropriate size. Whether it be too small, you can get accurate reading. Whether it be too large, you can get accurate reading. You want to make sure it's nice and snug. Okay? You want to make sure you have it on nice and tight, which it is, and it's not going to be sliding off. This is called a deflator. You want to pump it up to 180 and then you slowly start deflating it. You don't want to let it loose all of a sudden one first time, because you'll lose all your air and you'll have to pump it back up. This is called the gauge. You want to pump it up to 180. You want to keep your eye on it. And if you can't get a blood pressure, if you can't get the systolic with it, you want to deflate it, take it off the patient's arm, let all the air out, and then you pump back up to 200. Some patients, their blood pressure can be extremely high and you have to pump up to 220. You slowly start deflating. I'm putting the gauge back on. I'm going to put the stethoscope on. I'm going to tap the head, make sure I can still hear. Okay, I can still hear. And then I'm going to put the head of the stethoscope in the brachial artery that is located at the brachial of the patient's arm. And I'm going to start pumping up to 180. Okay, it's pumped up to 180. I'm going to slowly start deflating. (130) over 60. 130 over 60 is her blood pressure, and that's very good for her size, her age, and her health. You heard me say the two terms systolic and diastolic, okay? The systolic is when your heart is at pump. It's when it's working the most, like because the blood pressure cuff is squeezing against your arm, your heart's constantly pumping, so it's flowing a lot of blood to your heart. Okay, that's when it's most work, and that number is very critical. You don't want it over 180, 200, over 60. That is extremely bad. The diastolic is when your heart is at rest. That's when your heart's calmly beating and you're letting all the air off the blood pressure cuff. And 160 over 80 is very good blood pressure. You do not want your bottom number over top of 80, because that's extremely bad. You want to seek medical attention. If, for example, your blood pressure be 200 over 100, seek medical attention immediately. Okay? Thank you, ladies and gentlemen.